Failure is the opportunity to begin again, but more intelligently. That's the saying of Henry Ford, the pioneer who was just able to launch the Ford cars and wagons. He says that failure will just give you a chance to think again and to begin again with more intelligently than it was previously, to know your mistakes and your weaknesses. Now, the different types of the herpes infection, as I have mentioned in my previous slide, so I'm going to tell the detail of every disease now. The first one is herpes labialis. It is also called cold sores or the fever blisters, as it occurs after the fever gone. The most common presentation of the recurrent HSV1 infection following re-emergence of the virus from the trigeminal nerve, and here one can see the margin of the lips, and here again the margin of the lips and the corner of the lips. There are the blisters, and that is said to be the cold sores or the fever blisters. Number two is herpetic gingivostomatitis, as the name is explaining a bit. An initial presentation during the first herpes infection, it is of greater severity than the herpes labialis, which is subsequent presentation, and one can see the gingiva and the tongue is involved. That is just infection is on the tongue, and it is also on the gums. So it is called gingivostomatitis. Number three is eczema herpeticum. It is an infection with herpes virus in the patient who is already having the chronic atopic dermatitis. It results in spread of the herpes simplex throughout the eczematous area of the patient. So here one can see the eczema, and that is having the blisters of the herpes also. And again, the eczema and the herpes combine. So that is called eczema herpeticum. Now, eczema herpeticum symptoms are, there are skin lesions, there are itchy painful blisters and ulcers, there could be red, purple or the black blisters, and the patient is having fever and chills. There are enlarged lymph nodes, cervical and other groups, and there is malaise, the person is not fit. Number four is herpetic keratoconjunctivitis. As the name is self-explanatory, a primary infection with swelling of the conjunctiva and the eyelids, so it is called blepharoconjunctivitis, plus small white itchy lesion on the surface of the cornea, as one can see. So that is herpetic keratoconjunctivitis. Number five is herpetic psychosis, a recurrent or the initial herpetic simplex infection affecting primarily the hair follicles. So here one can see the chin and the mandible of the patient with hair follicles. These are having the blisters, so that is called herpetic psychosis. Number six is herpes esophagitis. The symptoms include painful swallowing, odynophagia, and difficulty in swallowing, which is called dysphagia. It is often associated with impaired immune function like HIV or the AIDS, immunosuppression in solid organ transplant, and here one can see the ulcers in the esophagus, and there is the herpes esophagitis, as one can see the lesions on the esophagoscopy, and these are the herpes esophagitis. Number 7 is herpes genitalis, as the name is, it involves the genitals. When symptomatic due to primary HSV1 or HSV2 genital infection as clusters of the inflamed papules or vesicles on the outer surface of the genitals resembling the cold sores. So here one can see the genital organs of the male and the vagina of the female. These, the penis and the vagina do have these kind of vesicles, and that is here one can see the labia that is having the blisters, and on the shaft of the penis there are the blisters. So these are the part of herpes genitalis. And the symptoms of the herpes genitalis are pain during urination, fatigue, small blisters that break open and cause painful sores, fever, headache, pain around the genitals, and the itching. Number 8 is herpetic whitlow. It is a painful infection affecting fingers or the thumb, sometime on the toes or on the nail cuticle. Here one can see the finger which is having the blister, and that is the presentation of herpetic whitlow. Number 9 is neonatal herpes simplex, HSV infection in the infant, rare but serious condition if that is there, caused by the vertical transmission of HSV1 or HSV2 from the mother to the newborn. And here one can see the vesicles and the blisters on the body of the newborn baby. Now, number 10 is herpes gladiatorum. It is also called scrumpox, wrestler's herpes, or the mat herpes. It is seen in the contact sports like wrestling, rugby, and the football. Disease is acquired due to HSV1 virus. Lesions presents as the skin ulceration on the face, ears, and the neck. Sometimes eyes and the eyelids are also involved. Symptoms include fever, headache, sore throat, and the swollen lymph glands. So here one can see the herpes gladiatorum. The lesions are on the face, on this part of the face, and on the neck also. Now, number 11 is herpes simplex encephalitis, which is called HSE, a rare life-threatening condition by HSV1, either from the nasal cavity to the brain temporal lobe. The nasal cavity is harboring the virus, and these are just going into the brain's temporal lobe from a peripheral site on the face along trigeminal nerve axon to the brain stem. So the journey of the virus from the peripheral site on the face along the trigeminal nerve axon entering to the brain stem. Here one can see the brain stem is involved, and these white areas are all the herpes infection as it has been seen by the brain scan. Number 12 is herpes viral meningitis. HSV2 is most common cause of molarets meningitis, which is the herpes viral meningitis. It is a type of recurrent viral meningitis, and one can see the red area which is presenting the herpes involvement of the brain tissue, and here again one can see on the scan the area involved and attacked or infected by the herpes virus. Now, 13, the type is the other lesions. It can lead to the Bell's palsy, a type of the facial paralysis. Exact cause is unknown, but it is said to be maybe HSV1 reactivation. Antivirals may improve condition slightly when used with the corticosteroid and the patient is having inability to close eyelids, drooping of the mouth, and the drooping of the water from the mouth, and it is all because of the facial nerve involvement causing the Bell's palsy and typical feature of the Bell's palsy. Now, the other lane is Alzheimer's disease. HSV1 may be a possible cause of the Alzheimer's disease, and here one can see the healthy brain and the brain which have been involved by the severe Alzheimer's disease. And here it is the beauty and the photographer who has taken the photograph, how much time he has waited for having this photograph when he saw the sun is right in between the branches of a tree. Now, what is the diagnosis? It depends upon 5 parts. Number 1, history and examination. Number 2, viral culture to detect the herpes DNA. Number 3 is serology. Number 4 is biopsy, skin biopsy. And number 5 is the PCR to detect the genetic of the herpes virus. Number 1 is the history and examination. Primary orofacial or the genital herpes is identified by the examination and contact with a person with known HPV infection. So the history also gives some clue. The appearance is multiple round superficial oral ulcer with acute gingivitis, and adults with a typical presentation are difficult to adults with atypical presentation are difficult to diagnose, and it is only possible when someone is having typical or classical symptom. So, prodromal symptoms help differentiate HSV symptom from the similar symptoms of the allergic stomatitis. Genital herpes is more difficult to diagnose as most people are not having the classical symptoms. Several conditions resemble the genital herpes like the fungal infection, lichen planus, atopic dermatitis, and the urethritis giving the same symptoms as the genital herpes. The number 2 in diagnosis is viral culture. Detecting herpes DNA in the fluid from the blisters and just diagnosing by having the direct fluorescent antibody test called DFA. Number 3 is the serology in the diagnosis. These are the tests for antibodies to HSV. It can confirm previous infection, not the recent new infection. IgM serologic assay could not differentiate between HSV1 or HSV2 infection. A glycoprotein G specific, which is IgG HSV test, is 98% specific to differentiate HSV1 from HSV2. Then number 4 in diagnosis is skin biopsy, and number 5 is the PCR for the presence of the viral DNA and to confirm the diagnosis. Now, there are certain differential diagnoses which are herpes zoster caused by the varicella zoster virus, hand, foot, and mouth disease due to the similar lesion on the skin, lymphangioma circumscriptum, dermatitis herpetiformis, allergic stomatitis, impetigo, which is a bacterial infection, and aphthous ulcer. These are the 7 differential diagnoses of herpes simplex. So here one can see herpes zoster, the shingle rash from the herpes zoster, which is classically on this part of the chest. Then a person is having hand, foot, and mouth disease, and one can have the blisters on the hand, foot, and mouth. Then one can see the blisters which are of lymphangioma, circumscriptum, and the dermatitis herpetiformis that also sometimes gives this kind of lesion. And allergic stomatitis that is also presenting like this. Then impetigo, a bacterial infection, and the aphthous ulcers, these are also having this. I have given already the lecture separately on impetigo, aphthous ulcer, and mouth ulcer. Here, these are the beautiful flowers, and one just think that these are the monkeys, but these are not the monkeys. These are the monkeys made by the God Almighty in the form of the flower, which looks like to be really like the monkeys. So the God creativity is unmatched. Now, coming to the treatment, no cure once infected as there is no vaccine. General medical treatment, there are four parts of the treatment. General medical treatment, topical anesthetics, antiviral, systemic and topical, and the alternate medicine. The first general medical treatment is analgesic like ibuprofen and paracetamol that can reduce pain and the fever which is associated with this disease sometime. Then topical anesthetics like prilocaine, lidocaine, benzocaine, or tetracaine that can relieve the itching and the pain of the blisters. And here one can see the topical anesthetic, prilocaine, lidocaine, mucopain, which is having the benzocaine, and here there is tetracaine available as amitop gel that can be applied on the blister to give relief. The third part of the treatment is antiviral, systemic and topical. Antiviral medication reduce frequency, duration and the severity. These reduce asymptomatic genital HSV while shedding. Effective oral antiviral drugs are acyclovir, valacyclovir, and famciclovir. The dosage of these drugs are going to be decided by the attending physician and the clinician, and valacyclovir is slightly more effective than acyclovir, and effective topical antiviral drugs are acyclovir, panciclovir, and docosanol. So here one can see the systemic antiviral acyclovir tablets, famciclovir tablets, and valacyclovir tablets. And this is given in the dose of 800 milligram about 5 times a day. This is 500 milligram 3 times a day, and this is also 500 milligram 3 times a day. That is, these two are more convenient to use rather than to have 5 times a day. So the topical antiviral are acyclovir and panciclovir and docosanol. These are used topically on the blisters. Now, the alternate medicine which can be used, that is echinacea, allothero, L-lysine, zinc, monolaurin B products, and aloe vera. Possible benefits with the aspirin, lemon balm, or licorice root cream has been seen. So here these are the products which can be used for the herpes labialis. These are the different kinds of the fruits as one can see. And for the genital warts, these are the things which are said to be of some help, and it also include the vitamin D, vitamin A, vitamin E, and the zinc. These are of some help in the genital wall. Now, the prevention is barrier protection like condoms can reduce the risk of herpes transmission. Like all sexually transmitted infections, women acquire more genital HSV2 than the men. without antivirals and the condoms. HSV2 transmission from infected male to the female is about 8 to 11%. Condom use prevent male to female transmission, then vice versa, as the virus cannot cross the condom. There are 30% low risk of having HSV2 infection. Asymptomatic carriers of the HSV2 virus are still contagious. A female condom provides greater protection than the male condom, as the female condom covers the labia. If there are ulcers on the labia, one cannot get the infection from the labia to the male. Now, prevention with the barrier methods, but herpes ulcers on the scrotum, anus, buttocks, or the upper thighs areas are cannot be covered by the male condom. So contact with the uncovered areas or the genital secretion during the sexual activity can cause the infection. So one can abstain from sex until the ulcers are fully healed. Then dental dams limit transmission of the herpes from the genitals of the one partner to the mouth of the other, or the vice versa during the oral sex. Tenofovir, when used topically in a microbicidal vaginal gel, can reduce the herpes virus sexual transmission by 51%. So here the male and the female condoms, the female condom also cover the labia, and here is the dental dam for the oral sex, and here that is tenofovir vaginal ring and the tenofovir topical insert, which can just reduce the herpes genital infection up to 50%. And that is the end of the lecture. I hope and I wish you may have liked this lecture. If you have liked this, please subscribe my channel, and I have tried to give as much as possible best which is in this lecture. And still, if there is any question or query, please feel free to contact. And thank you very much to be with me for this lecture. Thank you.